In-depth analysis, CIA's findings indicate 70% probability of COVID-19 originating from Chinese biolab. Date, January 26, 2025. Overview. The Central Intelligence Agency CIA has recently released an assessment suggesting a 70% probability that the COVID-19 virus originated from a laboratory leak in China, specifically the Wuhan Institute of Virology (WIV). This assessment has significant implications for ongoing debates surrounding the pandemic's origins, though it comes with a caveat of low confidence. This report will explore the timeline of events leading to this conclusion, the key points raised by various sources, and the implications of these findings. Timeline and background. 1. Early 2020. As COVID-19 began to spread globally, discussions emerged regarding its origins, focusing on natural transmission from animals versus a possible lab leak. 2. Late 2020 to 2021, investigations by the World Health Organization (WHO) and other entities explored both the natural and lab origin theories. Initially, the lab leak theory faced skepticism from many experts. 3. 2023, the narrative began to shift as FBI Director Christopher Wray publicly stated that the FBI assessed the origins of the pandemic to be most likely a lab incident. For January 2025, CIA Director John Ratcliffe, known for advocating the lab leak theory, declassified the agency's latest assessment, which points toward the lab leak hypothesis while acknowledging substantial uncertainty. Key points from various sources. Source 1: BBC. The CIA's assessment marks a significant change under John Ratcliffe's leadership. This report is based on a re-evaluation of existing intelligence, particularly concerning conditions at Chinese laboratories before the outbreak. The emphasis is on the lack of new intelligence, but rather a fresh analysis of what is already known. Source 2: AP News. This report highlights that the CIA's finding may be politically motivated, especially given the historical context of U.S. China relations. The agency acknowledges that definitive evidence may never be obtained due to Chinese authorities' lack of cooperation. The ongoing debate among scientists regarding the virus's origins is also emphasized. Source 3: Anadolu Agency. The CIA's position is framed as a culmination of analyses rather than new findings, with an acknowledgement of the plausibility of various theories regarding the virus's origin. Common themes. 1. Lab leak theory. All sources agree that the CIA is leaning toward the lab leak theory with a reported 70% probability. 2. Low confidence level. The consistent mention of low confidence across reports indicates significant uncertainty. While the agency favors the lab leak theory, it acknowledges the need for further evidence. 3. Political context. The timing of the CIA's assessment and involvement of high-profile political figures, particularly John Ratcliffe, suggest broader geopolitical considerations influencing the findings. Differences among sources. Focus on political implications. BBC and Anadolu Agency focus on the intelligence aspects, while AP News highlights the political ramifications, particularly reactions from U.S. lawmakers and the Chinese government. Details on evidence. BBC provides more context on the specifics of the CIA's reassessment process, while AP emphasizes the historical context and ongoing scientific debate about the virus's origins. Analysis of the CIA's findings. The CIA's new assessment represents a pivotal moment in the investigation into COVID-19's origins. By favoring the lab leak theory and assigning a probability of 70%, the agency acknowledges the importance of this hypothesis in understanding the pandemic's origins. However, the low confidence rating indicates that the evidence remains inconclusive and highlights the challenges of drawing definitive conclusions in the absence of clear and cooperative data from China. Implications of the findings. The CIA's findings could have far-reaching implications for international relations, particularly U.S. China relations. If the lab leak theory gains further traction, it could lead to increased scrutiny of Chinese laboratories and calls for accountability regarding the pandemic's origins. Furthermore, the political landscape in the U.S. may shift as lawmakers respond to these findings, potentially leading to more aggressive stances against China and calls for reparations or investigations. Conclusion: the CIA's recent assessment that COVID-19 most likely originated from a Chinese laboratory marks a significant shift in the narrative surrounding the pandemic's origins. While suggesting a 70% probability for the lab leak theory, the agency maintains a low confidence in the evidence available. As the global community grapples with the pandemic's ongoing effects, the debate over its origins remains a contentious issue shaped by scientific, political, and diplomatic factors. The path forward will depend on further investigations, international cooperation, and the willingness of all parties to engage in transparent discussions about the origins of COVID-19. The CIA's recent assessment regarding the origins of COVID-19 presents several counterintuitive points that challenge prevailing narratives and assumptions surrounding the pandemic's emergence. Here are some key counterintuitive aspects. 1. High probability with low confidence. The CIA's conclusion that there is a 70% probability of the virus originating from a lab leak, coupled with a designation of low confidence in this assessment, presents a paradox. One might expect a high probability to correlate with strong evidence. Yet the agency acknowledges significant uncertainty and inconclusive evidence. This situation complicates the interpretation of the findings, suggesting that even with a perceived likelihood of a lab origin, the evidence is not robust enough to conclusively support this theory. 2. Shift in intelligence community consensus. The evolution of thought within the intelligence community, particularly the acknowledgement by the CIA and FBI that a lab leak is plausible, contrasts sharply with earlier dismissals of this theory by many scientists and public health officials at the pandemic's onset. This shift raises questions about the reliability of expert opinions and the fluidity of scientific consensus, indicating that what was once considered fringe speculation is becoming mainstream despite lacking definitive proof. 3. Political influences on scientific inquiry. The timing of the CIA's reassessment and the involvement of politically appointed figures such as John Ratcliffe suggest that political motivations may be influencing intelligence assessments. This raises the counterintuitive idea that scientific inquiry and intelligence reporting may be susceptible to political agendas, challenging the notion of objectivity in these assessments. The CIA's findings can be interpreted as potentially serving broader geopolitical narratives rather than solely scientific inquiry. 4. Limited cooperation from China. The CIA's acknowledgement that definitive evidence may never be obtained due to China's lack of cooperation is a critical counterpoint. It suggests a tragic limitation in the pursuit of truth about the pandemic's origins, where the political landscape inhibits scientific investigation. This reveals the broader implications of international relations on public health inquiries, highlighting that geopolitical considerations can overshadow the quest for objective scientific understanding. 5. Persistent plausibility of multiple origins. The CIA's assertion that both research-related and natural origins remain plausible challenges the binary framing of the debate. Many narratives have suggested a clear dichotomy between a lab leak and a natural spillover from animals, but the intelligence community's findings suggest that the reality may be more complex and nuanced. This complexity complicates public understanding and discourse around the origin of the virus, suggesting that simple explanations may be misleading. 6. Historical context of intelligence assessments. The report indicates that the CIA's findings are based on a reassessment of existing intelligence rather than new evidence. This raises an interesting point about the nature of intelligence work. The same data can lead to different interpretations over time based on prevailing conditions, leadership, and societal pressures. This suggests that intelligence assessments are not static and can evolve, which could lead to misinterpretations of the reliability of past assessments. 7. Public perception and scientific discourse. The CIA's shift towards supporting the lab leak theory may influence public perception significantly, potentially leading to increased skepticism towards natural origin theories that were previously dominant in public discourse. This shift underscores the counterintuitive relationship between intelligence findings and public health narratives. A change in the narrative from a respected institution like the CIA can reshape public belief systems regardless of the underlying scientific evidence. 8. Implications for future research. The CIA's findings may inadvertently stifle further inquiry into natural origins due to a new focus on the lab leak theory. This can lead to a situation where research funding and public interest disproportionately favor one theory over another, potentially limiting the comprehensive investigation necessary to understand the pandemic fully. This raises concerns about how scientific priorities are influenced by prevailing narratives and intelligence assessments. In conclusion, the CIA's assessment introduces several counterintuitive elements that challenge established narratives around the origins of COVID-19. The relationship between intelligence politics and scientific inquiry is complex, and the implications of the CIA's findings extend beyond mere probability assessments, influencing public perception, international relations, and future research priorities. The CIA's recent assessment indicating a 70% probability that COVID-19 originated from a laboratory leak at the Wuhan Institute of Virology is significant for several reasons, particularly in the context of the evolving narrative around the pandemic's origins. While the report is a critical addition to the body of research regarding COVID-19, several important aspects are likely to be overlooked by the general public and warrant closer examination. 1. Low confidence in findings. One of the most crucial points that may be overlooked is the CIA's designation of low confidence in its assessment. This phrase implies that while the agency leans towards the lab leak theory, the evidence supporting this conclusion remains inconclusive or contradictory. The significance of this low confidence lies in its implications for policymaking and public perception. It suggests that despite a high-profile endorsement of the lab leak theory, the intelligence community itself recognizes significant gaps in evidence. This could lead to more polarized public opinion and a potential overemphasis on the lab leak theory without sufficient grounding in scientific consensus. 2. Historical context and geopolitical implications. The timing of this assessment is noteworthy, especially in the context of U.S. China relations. The CIA's report comes amidst a backdrop of increasing scrutiny of China's handling of the pandemic and its transparency regarding the origins of COVID-19. Analysts and historians might overlook how these geopolitical dynamics shape the narrative around the virus's origins. The implications of framing the pandemic as a result of Chinese negligence or malfeasance have far-reaching consequences for international relations, trade, and public health policy. The report could intensify calls for accountability from China, potentially leading to diplomatic tensions that may not be immediately evident. 3. Re-evaluation of existing evidence. The assessment indicates a re-evaluation of existing evidence rather than the introduction of new intelligence. This is significant as it highlights a shift in the analytical framework within which intelligence agencies operate. Many people might overlook the fact that such reassessments often reflect deeper institutional understanding and learning processes which can alter the interpretation of data collected in the past. This suggests that intelligence agencies are evolving in their methodologies and may be more open to questioning previously held assumptions about the origins of pandemics. 4. Continued plausibility of natural origins. Despite the CIA's lean towards the lab leak theory, the report emphasizes that both research-related and natural origins remain plausible. The ongoing debate around the origins of COVID-19 often simplifies a complex issue into binary conclusions. Overlooking the continued plausibility of natural origins could skew public and scientific discourse, leading to a one-dimensional understanding of zoonotic diseases and their pathways into human populations. This complexity is vital to informing future pandemic preparedness and response strategies. 5. Political motivations and leadership influence. The influence of political figures, particularly John Ratcliffe, the newly appointed CIA director, is another often overlooked element. Radcliffe's long-standing advocacy for the lab leak theory and his role in declassifying the assessment raise questions about how political motivations can shape intelligence conclusions. The perception of politicization in intelligence assessments can undermine public trust in governmental institutions, especially during a health crisis. Understanding the political context is essential for discerning how narratives around health crises are constructed and propagated. 6. Implications for future research and investigations. The CIA's findings underscore the need for continued investigations into the origins of COVID-19. Many might overlook the fact that the conclusions drawn from intelligence assessments should catalyze more rigorous scientific inquiries rather than serve as definitive answers. The call for transparency and cooperation from Chinese authorities remains critical, yet it is often underappreciated in public discourse. The future of global health security may depend on the international community's ability to engage in collaborative research efforts that transcend political boundaries. 7. Public health messaging and trust in science. Finally, the implications of the CIA's assessment on public health messaging are profound. The lab leak theory's resurgence could influence public trust in health authorities and scientific consensus. Many people may not fully grasp how narratives about the origins of diseases can affect compliance with public health measures and vaccine uptake. As fears of bioweapons and laboratory accidents resurface, public health officials must navigate a delicate balance between transparency and reassurance to maintain trust in health systems. Conclusion: the CIA's assessment regarding the origins of COVID-19 is a pivotal development, yet many critical aspects may be overlooked in broader discussions. The interplay of confidence levels, geopolitical implications, historical context, continued plausibility of various origins, political motivations, and the need for ongoing research are all significant factors that contribute to a more nuanced understanding of the pandemic's origins. As the global community continues to grapple with the aftermath of COVID-19, these dimensions will be essential in shaping narratives, policies, and future pandemic preparedness strategies. 1. Shift in intelligence consensus. The CIA's assessment represents a notable shift in the narrative surrounding the origins of COVID-19. The report suggests a 70% probability that the virus originated from a lab leak at the Wuhan Institute of Virology, contrasting with the previously dominant hypothesis of a natural transmission from animals. This change reflects evolving analyses within U.S. intelligence agencies, which have increasingly considered the lab leak theory as a plausible explanation, particularly following assertions by the FBI and other intelligence entities. The convergence of assessments from multiple agencies indicates a broader acknowledgement of the lab leak theory's viability, despite ongoing debates within the scientific community. 2. Low confidence in findings. Despite the shift towards the lab leak hypothesis, the CIA explicitly states that it has low confidence in this conclusion, highlighting the inconclusive and sometimes contradictory nature of the evidence available. This cautious stance suggests that while the agency leans towards the lab leak theory, it recognizes the absence of definitive proof. The acknowledgement of low confidence in intelligence assessments is critical as it emphasizes the complexities and uncertainties surrounding the origins of the pandemic, which may never be fully resolved due to factors such as lack of access to data and cooperation from Chinese authorities. 3. Political context and implications. The timing of the CIA's assessment is significant, particularly in light of the political landscape. The report was declassified under the new CIA Director John Ratcliffe, a figure known for advocating the lab leak theory. This context raises questions about potential political motivations behind the release of the assessment, especially given the historical tensions between the U.S. and China. Reactions from U.S. lawmakers, particularly those in favor of attributing blame to China for the pandemic, further underscore the intertwining of scientific inquiry with geopolitical dynamics. The implications of the report may influence U.S. China relations, domestic political discourse, and the broader narrative surrounding accountability for the pandemic's origins. 4. Need for international cooperation and further investigation. The continued uncertainty regarding the origins of COVID-19 underscores the necessity for international cooperation in investigations. The CIA's findings stress that definitive answers may be elusive without collaboration from Chinese authorities, who have historically dismissed the lab leak theory as politically motivated. The call for transparency and investigation into laboratory conditions in Wuhan emphasizes the importance of global scientific collaboration to understand the origins of pandemics. As the world grapples with the ramifications of COVID-19, addressing the origins could play a crucial role in preventing future outbreaks and fostering trust in international health governance. 1. The Manhattan Project and the Atomic Bomb. The Manhattan Project was a secret U.S. government research project during World War II that produced the first nuclear weapons. The project was initiated in response to concerns that Nazi Germany was developing its own atomic bomb. The project involved significant ethical debates regarding the implications of nuclear warfare and the potential for catastrophic consequences if such technology fell into the wrong hands. The secrecy surrounding the project and the eventual use of atomic bombs on Hiroshima and Nagasaki led to ongoing discussions about the morality of nuclear weapons and the responsibility of scientists in warfare. 2. Tuskegee Syphilis Study, conducted between 1932 and 1972. The Tuskegee Syphilis Study was an unethical clinical study conducted by the U.S. Public Health Service. The study aimed to observe the natural progression of untreated syphilis in African American men in Alabama under the guise of free healthcare. The participants were not informed of their diagnosis or given treatment even after penicillin became the standard treatment for syphilis in the 1940s. The study raised significant ethical questions regarding informed consent, racial discrimination in medical research, and the exploitation of marginalized populations, leading to major changes in U.S. law and ethics in medical research. 3. The Gulf of Tonkin Incident. In August 1964, the Gulf of Tonkin incident involved two separate confrontations between North Vietnam and the U.S. Navy. The first reported incident, which allegedly involved an attack on a U.S. destroyer, was followed by a second, less clear event. The U.S. government used these events to justify increased military involvement in Vietnam, leading to the escalation of the Vietnam War. Later investigations revealed that the evidence surrounding the second incident was questionable, prompting debates about government transparency, the manipulation of intelligence, and the consequences of military interventions based on potentially fabricated or exaggerated threats. The CIA's recent report suggesting a 70% probability that COVID-19 originated from a Chinese biolab marks a significant shift in the narrative surrounding the pandemic's origins. This conclusion, while influential, is accompanied by a low confidence level indicating the agency's reliance on inconclusive or contradictory evidence. As we approach the future, the implications of this assessment could reshape public health policies, international relations, and scientific research. Predictions for the future. 1. Increased scrutiny of global health security. The lab leak theory gaining traction underscores the necessity for enhanced global health security protocols. Nations may invest more in monitoring and regulating biolaboratories, particularly those involved in high-risk research. This could lead to the establishment of international standards and agreements to oversee laboratory practices, ensuring they prioritize biosafety and biosecurity. 2. Political implications and tensions. The CIA's findings may exacerbate tensions between the U.S. and China. As political leaders and lawmakers in the U.S. push for accountability, we may witness a rise in calls for sanctions or international investigations into China's handling of the pandemic. This could further strain U.S. China relations, impacting trade and diplomacy. 3. Scientific research and transparency. The controversy surrounding the origins of COVID-19 may lead to increased calls for transparency in scientific research, especially regarding pathogens that pose global health risks. Funding agencies could prioritize research that focuses on understanding the origins of viruses and improving response strategies. This shift might also encourage collaborations between countries and institutions to foster data sharing and transparency. For the public health policy changes, as the narrative around the pandemic's origins evolves, public health policies could be re-evaluated. Governments may implement stricter regulations on animal markets and wildlife trade, as these are considered potential pathways for zoonotic diseases. Additionally, there may be a push for more comprehensive pandemic preparedness plans that take laboratory safety into consideration. 5. Continued investigations into COVID-19 origins. The lack of definitive evidence regarding the virus's origins suggests that investigations will continue. International bodies like the WHO may conduct further studies, and independent scientific groups could emerge to explore the origins, seeking to clarify the narrative. This ongoing inquiry could become a significant aspect of international relations and global health discussions. 6. Shift in public perception. The CIA's report may alter public perception regarding the pandemic's origins. As more people become aware of the lab leak theory, there may be a shift in attitudes towards global health governance and the role of scientific research. This could lead to greater public demand for accountability and transparency in health organizations and governments. 7. Impact on future pandemics. The ongoing debate about COVID-19's origins may influence how future pandemics are approached. Lessons learned could encourage a more cautious approach to research involving pathogens, particularly in labs with less oversight. This could lead to an emphasis on developing preventative measures rather than reactive ones, focusing on early detection and rapid response. 8. Technological advances in viral research. The uncertainty surrounding COVID-19's origins may drive technological advancements in viral research and diagnostics. Investments in biotechnology and bioinformatics could accelerate the development of tools for monitoring and understanding viruses before they lead to widespread outbreaks. 9. Geopolitical strategies. Countries may re-evaluate their geopolitical strategies in light of the CIA's findings. Nations involved in biotechnology and virology research may face increased scrutiny and pressure to cooperate with international investigations. This could lead to a realignment of alliances based on shared interests in biosecurity and public health. 10. Increased focus on ethical considerations. As the debate over COVID-19's origins continues, ethical considerations surrounding laboratory research and experimentation with pathogens may become a focal point. Discussions regarding the moral implications of gain-of-function research and other controversial practices could lead to new ethical guidelines and regulations. In conclusion, the CIA's assessment regarding the origins of COVID-19 is likely to have far-reaching implications for global health security, international relations, and scientific research. As the narrative unfolds, it will be crucial for governments, scientific communities, and international organizations to navigate these challenges with transparency and collaboration to ensure a safer future. The lessons learned from this pandemic may influence how the world prepares for and responds to future public health crises.